First of all, I'd like to ask you both permission. You're part of it. You observe him all the time.
Yeah.
I ask both your permission to use this video for educational purpose and on the internet.
Absolutely.
I would like to first tell me what your symptoms were, and I'd like as well to ask you afterward, what did you observe about his daily life? Go ahead, tell me what your symptoms were.
On my daily life, I would struggle with even just doing like the natural things that like you should be doing as a teenager.
Yeah.
Just always having pain from the moment I wake up to trying to fall asleep.
Can you describe where the pain was?
It was right in like the lower back, right above like your buttocks. That was where majority of my pain would come.
When did you notice that pain? When did you start having that pain?
Oh, I'd say probably 7th grade, which would have been 5 years ago now.
5 years ago.
Yeah.
1 to 10, what would you call the intensity of that pain that you had?
It would vary from day to day, but it would go anywhere from I'd say like a 5 to even like a 9.
5 to 9.
Yeah.
Well, what did you observe on his daily life in that time frame? He's a teenager. You know, they are supposed to be active. What did you notice?
He was really restricted, and
Yeah.
it was a daily thing, complaining about his back. No matter
Okay.
what he was trying to do, I would hear about it all the time. I can say since he's had the surgery, I haven't heard anything about his back. Once he's been able to kind of move around without the crutches and stuff,
Yeah,
I haven't heard about it. He's done very well.
Excellent. So that pain is gone?
Oh, absolutely. The daily pain that I used to struggle with is
Gone.
Not
When
at
did
all.
you notice the pain is gone?
I would say maybe like a couple weeks ago to
Couple
a
of
month
weeks ago?
ago. I have had like
The surgery was about, what, 4 months ago or
Yeah.
3 months ago?
I'd say probably 4.
4 months ago. So it took you about 4 to 8 weeks, but then after that you noticed that the pain is different or gone?
Oh yeah,
Okay.
major.
Now, how did we get to a point that we said, you got the sacroiliac joint fusion? I'm going to turn around and just show it here. This is the trident system we put in. By the way, we have to put more than one screw, because if you put only one screw, it still can rotate. So we put the 2 or 3 screws, preferably 3 screws. But the advantage of this system is that once we put the first screw, through the screwdriver of the first screw, the other screws go in, so I don't have to make new holes, new pokes in you. The surgery was done just about 4 months ago.
Yep.
How long did you stay in the hospital?
Not long at all.
Just few
I
hours?
was in there for
Hours.
maybe a total of like 2 to 3 hours.
2 or
that
3
year.
hours,
fast.
yeah.
Yeah.
And the surgery took us only 20 minutes. That's all. Now, this surgery would not have been possible even 15 years ago. 15 years ago, when I was getting trained 20 years ago, the solution for that was worse than the disease. It was a really long, bloody surgery. But we have come a long way, obviously. But tell me about, how did we get to the point that we said this is your problem? What did we do to diagnose you properly? You remember what we did?
I don't think so, no.
No? Do you remember what we did to
He had
diagnose
some
you?
CT scans.
He
He had
got
to
the
go
CT
physical therapy.
Oh, I had
He's tried
multiple
a
cortisone shots as well.
cortisone
And you don't
shots.
injection. The cortisone
Yes.
shot, actually the part of the cortisone shot that was for diagnostic purpose, cortisone sometimes can fix it. So when I do the injection, I always put it in. But the actual part, that was the numbing medication. Now we
Then it was
numb.
to if he was
Yeah.
still having pain after you did that, or if he felt results.
Yeah, now
after you
same
did
thing
those.
like the dentist,
It
you know.
helped. to know if it was
Exactly.
gonna
Because
work
then
or
we
not.
knew exactly where to attack and how to get
Yeah.
rid of it.
Yeah. So we did multiple injection. I numbed it up, and while numb, the pain was gone. That proved to us that that's where the pain is coming from, and that sort of enabled us to diagnose you and then do the procedure. It is surprisingly still that lots of people don't have the knowledge or education to deal with that. They see people like you and they just tell you nothing is wrong, go live with it, it's in your head. And lots of people become narcotic addicts in
You do,
young
and you
age.
hear a lot of different things about it.
Yeah.
I know as a parent,
Yeah,
he was only 17,
Yeah.
and I'm like, does he really need this, or is this
Yeah.
some, But then the more I thought about it, I'm like, for a 17-year-old to be in pain and complain
Yeah.
about their back day in and day out, to restrict
Yeah.
themselves, I thought, if he's game for it,
Yeah.
I let him kind of make that choice, because
Yeah.
he was 18 around the corner.
perfect.
And I'm glad we did. I haven't heard anything.
Yeah.
Honestly,
No,
he did very well with the
there
surgery.
is actually, for good reason, we used to do lots of spine surgeries on young people, and the spine surgery would sometimes cause more problem than the solution. And so lots of spine surgeons are very restrictive to give any solution, surgical solution, to young patient,
Mm-hmm.
because weighing risk versus benefit. For that reason, they say you're too young. So often people hear you're too young for surgery. The consequence of that, unfortunately, is you go and you suffer 20 years.
Yeah.
Your whole life becomes just about managing the pain until you're old enough, in apostrophes, for a surgery. But these days, I think we have better tools, and that is exactly what we did. Overall, so far, happy with the results.
Very.
Excellent. No, but now, what we talked about, you have 2 sacroiliac joints. Statistically, when you have one side done or have problem with one side, about 50% chance that you need the other side done. So in a case like that, where you have a problem, you just have to adjust your daily life, not to overuse the joint, the joint itself. Okay,
Yeah.
and that hopefully keep you out of my office. Okay,
Yeah.
thank you very much. I appreciate
course.
that.